In London, infection rates are on a steep upward path, with the number of cases doubling every 10 days. The 7-day average case rate stands today at 97, rising sharply. We know from the first peak that the infection can spread fast and put huge pressures on the NHS, so we must act now to prevent the need for tougher measures later on. So working closely with the Mayor, with cross-party council leadership, with local public health officials and the national team, we've together agreed that London needs to move to local COVID alert level high. Working with local leaders in Essex and Elmbridge, we're also moving them into local alert level high. And I want to pay tribute to the leadership of Essex County Council and in Elmbridge, where they've been working so hard to suppress the virus. Mr. Speaker, infection rates are also rising sharply in Barrow-in-Furness, in York, in North-East Derbyshire, in Erewash and Chesterfield. In all of these places, cases are doubling in less than a fortnight. For all of the areas entering the high alert level, the change will come into effect 1 minute past midnight on Saturday morning, and this includes Barrow-in-Furness, York, North East Derbyshire, Erewash and Chesterfield too. The central change is that people cannot now meet other households socially indoors. This applies in any setting, at home or in a restaurant or in any other venue. The rule of 6 still applies in any outdoor setting. And although you may continue to travel to open venues, you should reduce the number of journeys where possible. Parts of the country where prevalence of the virus is highest. Discussions are ongoing with local leaders on moving from high to very high. These are areas where transmission rates are rising at the sharpest rate and where we see a very real risk to the local NHS. The Liverpool City region moved into the very high level yesterday, and I want to thank the local leadership for their public service and cross-party teamwork in the face of this virus. I didn't come into politics to put restrictions on people's lives, and I want people to have as much freedom as possible, subject to not harming others. But the nature of this virus means that any one of us can inadvertently pass it on without even knowing. Now, I know that these measures are not easy, but I also know that they are vital. Mr. Speaker, responding to this unprecedented pandemic requires difficult choices. Some of the most difficult choices any government has had to make in peacetime. We make these decisions with a heavy heart, with the sole aim of steering our nation through troubled waters. Things will get worse before they get better, but I know that there are brighter skies and calmer seas ahead, that the ingenuity of science will find a way through, and until then, we must come together, because we all have a part to play in defeating this dreadful disease.